Well, the second wave of Covid-19 in India has not spared anyone, young or old. Younger people have been hard hit, and among them are pregnant women as well. Brazil, for instance, has asked women to postpone pregnancies if possible, saying that the variants of Covid-19 this time around have been more aggressive in pregnant women, with a sharp rise in pregnant and postpartum deaths. India too is witnessing this trend. Now, there is no data to support this, but doctors who are treating pregnant women say there is enough anecdotal evidence to say they are at a higher risk in the second wave of COVID. One such tragic story is that of Dr. Dimple Arora Chawla. She tested positive for COVID on the 11th of April. On the 25th of April, she lost her child, and on the 26th of April, she died. Her husband, Ravish, joins us on NDTV today. When I spoke with Mr. Chawla earlier, he told me that it was her wish to spread awareness about this disease so that nobody takes it lightly. Remember, she was a doctor. He's here to honor her wishes. But first, let's listen in to this video message that Dr. Deepika Chawla recorded on the 17th of April.
ये वीडियो बना रही हूँ बहुत मुश्किल से. I really want to tell each and everyone जो मुझे जानता है, please don't take corona so lightly. Very bad symptoms. I am not able to speak, but I really want to convey my message to all. Please wear mask whenever you go outside, whenever you interact with people. Either it is outside, either at home, for your near one and dear one's safety.
All right, an important message over there. We have Ravish Chawla with us. Mr. Chawla, thank you very much for speaking with NDTV, for speaking out at a time like this. We understand this is an extremely difficult time for you and your family. Our deepest condolences. What is the message that you'd like to give out?
The only message that I want to give is my wife's. What she wanted was to let the people know, since she herself was a doctor, she was a public health dentist, so it was in her innate nature to inform people about what precautions they can take. So she had actually made this for her family and friends, but her untimely demise led me to post this message to the world so that the world can know that you should not take COVID so lightly. That it was her message, and you should be wearing masks, and not just for yourself, but for the elderly or the pregnant women, and they may be people with comorbidities at home. So you should wear masks. You should care about the people at home. That was my wife's message that I just want people to know about. And yes.
Right.
So one more thing, since she succumbed to COVID because of pregnancy also, she was pregnant also, and so herself was a doctor, so she took a lot of precautions that I don't want to get this medicine, I don't want to eat this medicine, I don't want to get the CT scan done right now because it may harm the baby. So we were also going here and there asking what should be done in pregnancy, to take this or not to take this, because there are certain guidelines for general people, but there are no set specific guidelines for pregnant women in India. So I'm sure if my wife's Deepika's message goes out, so all the pregnant women watching there, they can also better take care of themselves, isolate themselves, and also to people let people know that there are pregnant women, there are elderly people at your home. Please do wear masks. Please do take care of yourself. If not for yourself, but for elderly and pregnant women like this. I don't want the tragedy that has happened to my family happen to anybody else.
Well, Mr. Chawla, it is extremely courageous of you to speak at a time like this. One can't even begin to imagine what you and your family are going through. But I think you're giving out a very important message. Your wife was a doctor. She was pregnant. She took all the precautions, and yet she contracted COVID. I want to just ask you, before we let you go, what were the kind of complications that arose What was, would you be comfortable to share what eventually happened?
So she was on oxygen support. Her oxygen level started to go down on 21st and below 90, and we immediately took her to hospital. And on hospital, so she was there for a couple of days, and she was administered, remdesivir and plasma therapy when her situation started to deteriorate a lot. Because earlier, even the doctor said, that there are no studies or guidelines to prove that remdesivir or plasma is good or bad. We don't know. But when her situation started to deteriorate a lot, her oxygen level started to drop a lot, the doctor said, the doctor asked us, and they said that, we will now have to consider as an individual now, because there are no such studies for remdesivir and plasma. Although we had to go about it, we could, so we were given an option. So remdesivir and plasma, so she was administered she was transfused with 2 plasma therapies as well, and also 5 days of remdesivir. And after all those, on 25th of April, her labor pain started. She was in her 7th month of pregnancy. Her labor pain started, and when the ultrasound happened, so it was discovered that the fetal heart rate of the baby is not there, so her baby had died in the womb. So it was quite shocking for her. Initially, I didn't tell her, but the doctor said, we will need to get her to cesarean. We need to abort the baby so that it does not harm her. So we'll have to tell her. So she, held her. She was very brave and strong-willed partner. So she had been braving this for the past 7 days. Whenever she used to lie down, her oxygen used to, fall. So the doctor had told her, she was sitting. She was literally sitting for like 5 to 6 days continuously. She would sleep, her oxygen would fall. She would lay down, she would go a little back, her oxygen would fall. So doctors will advise, and even she did not want to sleep. I want to, get better. I want to get better for the baby. I want to get better for myself. So she was sitting for 5-6 days continuously throughout. It was quite painful for me to see that as well. But there was no other option but to brave it. And she did it very, very willingly. So after this cesarean happened, I don't know, when she came back from the operation theater in the ICU, she got panicked, I want to see my baby, I want to see my baby. And in her anxiety and something, her oxygen level started to drop. So when that started dropping, I somehow had to tell her, yes, your baby is alive. I had to lie to her, which I did not want to, but I had to lie to her that you've got a boy, the baby is alive. They have taken him to the NICU. So upon listening to that, her oxygen level started to move up a little. And but since her oxygen level started to drop, she was put on NIV, non-invasive ventilator. So the bigger mass was making her uncomfortable,
right.
And she was feeling something which she was not able to tell. And so she was panicking. So she was given an injection for sleep, reduced sleep. So when she slept, her oxygen level came up, and somehow when she woke up, her situation started to deteriorate, and doctors could not save her the next morning, 26th of April. She left us.
Mr. Chawla, we have no words. Our deepest condolences with you and your family. May you have all the strength you need to tide over these times. Thank you very much for your courage, for speaking out, for sending out this very important message. Your wife wanted you to send out this message, and you have with so much grace and dignity. Thanks so much for speaking with NDTV.
Just one thing before I go.
Sure.
The one I came here and I also spread the word to people just because she wanted people to know about this thing, even in her pain and agony. And I want my 3.5-year-old child, who she has left to us, that, whenever he grows up, that, her mama was a hero. She was disseminating a message to people, even in her own pain and agony. So I want this for my son, Vian, as well. So that's it.
She was a hero. Thank you so much, Mr. Chawla. Thank you.
Thank you.